I'm Deborah Smith for Radio Southland 96.4 FM, and I have Jacqui Dorna on the phone to me from Perth. And Jacqui is going to talk about her work as a practicing hypnotherapist. Jacqui, welcome on to the program.
Oh, bless, Deborah, thank you.
Now, we may as well get straight into it, Jacqui. How long have you been working in the field of hypnotherapy?
Well, I've been practicing clinical hypnosis, Deborah, since 2008.
Okay. And whereabouts did you get qualifications for something like this?
Well, I actually studied at the Australian Academy of Hypnosis, which is an internationally recognised organisation here in Perth. And I wanted to make sure that, where I actually undertook the studies, it was both government recognised and accredited.
Okay, that would be important. And how long did it take you to do that?
Well, actually, the study's still ongoing because depending on your level of interest and whether you want to specialise in a particular field or not, some people will just specialise only in stop smoking, whereas other people will continue on and look at other avenues as well. Initially a year.
Okay.
And as I said, I'm still training.
Still training now?
Yes.
Okay, all right. Bit of background noise there, Jacqui.
I'm getting rid of it.
Okay. Now, what sort of hypnotherapy, you're right across the board, or are you limited to a certain area at the moment?
Well, actually, I sort of work right across the board in a lot of areas, whether it's eating or weight loss, phobias, trauma, self-esteem issues, cancer for the symptoms related to the actual treatment.
Okay. And can anyone be a hypnotherapist, Jacqui, in your opinion?
Well, almost anybody. You just need to be of good character and sound mind, and obviously have a desire or a passion to want to actually help people. And obviously you need to be able to communicate. That's very important, because sometimes you need to answer those questions that can be a little bit difficult for the clients to answer, so that you can get to the bottom of what's going on in their life.
Right. So now let's get to the hypnotherapy, an actual session. Can you give me an example of how you know a client can be hypnotised or is hypnotised? How do you do that?
Well, look, hypnosis is a learned process, pretty much like learning to ride a bike. Some people need the balancing wheel for a little while, some people learn quicker. Basically, we have inductions and that sort of thing. We use different techniques to get them hypnotised. As an example, one of the techniques I use is to actually lock their arm onto the chair. That way then I know that they can't move. I ask them to move the arm, they can't. And that's a convincer for the client also, to know that they are hypnotised.
Okay.
And also, obviously, the client has a desire, so they're wanting to make a change in their life. So that's part of the process also.
What happens if the person can't be hypnotised? I mean, they actually lift their arm off the chair, they've got their eyes shut. You know then that you've got a bit of a problem?
Well, then we just keep on going, Deborah. Look, it's about getting them to a depth where they are deep enough to get a result. So you bring them out of the hypnosis, set them up again, drop them back in, and you just drop them in and out until they get to such a point that the conscious mind goes off, which is the everyday mind, that one that says turn off the kettle, lock the car. And then we get access to the subconscious mind, where we make the changes on the patterns and the habits.
Right. So now, getting to the clients, what are some of the issues that clients come to you with, Jacqui?
Well, obviously weight loss, weight maintenance, weight management, those sorts of things. Cancer patients with, the severe nausea that they experience after they've had treatment, and the sensitivity to light and sound, irritable bowel syndrome, sleep disturbance, addiction, trauma. Look, the list is endless. Basically, to me, the only limitations there is on hypnosis is what society and ourselves place on it. Really, you can pretty much go into anything with it.
Well, what are some of the issues that you won't treat people for? What are your professional limitations at the moment, Jacqui?
Well, look, I wouldn't treat anyone with schizophrenia or bipolar disorder, psychosis, or multiple personality disorders. Clients with those issues would actually need to consult a hypnotherapist who specialises in those areas.
Okay. And have you had anyone come to you with any issues like that, wanting assistance, or no?
If I have, what I do is I refer them on to someone that's a little bit more experienced in that area.
Right. Okay. So
I'm sort of more the pain relief.
Okay.
And the other things.
Okay. Right, well, getting to the actual hypnotherapy session, how long does a typical session last, Jacqui?
Well, it really depends on the client's needs, whether they're coming just, say, for one issue, which may be, say, anxiety, but then attached to the anxiety there could be stress, there could be a few other things that could flow into the workplace, into the home life. Generally around about an hour and a half, but if necessarily even up to 2 hours.
Gee, that's a bit of work for you, isn't it?
Oh, bless, but I love it, Deborah.
Yeah.
Look, I'm passionate about it.
That's a long session. Now, when a person is hypnotised, is there any danger for the client? I mean, some people think that the hypnotherapist could tell them to do, well, silly things. You know what I mean? Go and sit in the middle of the road and recite Shakespeare or something like that.
No, look, at the end of the day, clinical hypnosis and hypnotists, look, we can't make you do anything which is against your morals. And look, when you're hypnotised, you're totally aware of what is going on and what you're doing. And look, we don't take control of your mind, you know. When people go to a stage hypnotist, well, that's something different. They know they're going up on stage. They know that they're going to be made a fool of, and it's for the entertainment of everybody else in the audience. So they're, in a sense, already agreeing to either cluck like a duck or be a stripper or whatever.
Right. And I suppose that's all very well, isn't it? But when it gets to more emotive issues like you're dealing with, it's not funny at all for a lot of people, is it? Especially people in pain. You deal with that, don't you?
Yeah, I do. Look, what we do is, you know, someone will come for a pain session, and so we'll get them to, you know, relax, identify where the pain is, and then give them the tools so that they can actually go in and turn their pain level down, have a better quality of life. And that gets them off the copious amounts of painkillers that they've been taking, and obviously they have an effect on the system internally as well. And look, quite often we work in conjunction with treating physiotherapists or doctors and that sort of thing as well.
So you're working on the subconscious part of the brain, the subconscious mind.
Yes.
Yeah. And that can turn off pain?
It can. Look, that's your hard drive. That's where we store everything. And it's about placing your tools in there, for an example, like a button or a lever that the person can actually go in at a mental level and turn it down and turn their pain level down. Look, obviously we don't want them to turn it off completely, because I don't want to see them outside on the roof doing something that they shouldn't be doing. Pain is the body's way of saying, hey, I'm healing, I need time to do this. But if we can turn it down just so that they feel better, they have a better quality of life, there's a lot of benefits there for them.
Now, what's your success rate been like to date, Jacqui?
Well, actually, the success rate has been really good. And look, at the end of the day, people can visit the website, sallieinternational.com, and read the testimonials.
Okay. Now, you're heading over to New Zealand very soon in May, aren't you?
Yes, look, this will be my 4th visit in 12 months, and we arrive back in Invercargill on the 29th of April, and we're going to be running a workshop in Gore and Invercargill, as well as doing private hypnosis sessions.
So how can people get in touch with you? They make bookings for this session, for the sessions, for the workshop. How do they get in touch with you, Jacqui?
Yeah, look, they can send me off an email if they like, to Jacqui25@bigpond.com, or they can contact Sue Dawson, who is my representative on the ground there in Invercargill. That's
right, yes, she is.
And her contact phone number, her mobile is 0274 305 956.
956. So if they want to email you for to book themselves in, Jacqui25@bigpond.com, or contact Invercargill, Sue Dawson, 027 4305 956. And I guess I'd better let you go, and we'll be talking to Glenys Elkins next. But Jacqui, I'd like to thank you very much for talking to us today, and I'm sure that I'll be looking forward to meeting you when you're here too, because I'm going to have a wee chat with you, aren't I?
Oh, bless you, if you are, most definitely.
Okay, so I'll be meeting up with you at the Yoga Centre in Invercargill next month.